Well, sometimes along with high-level athletic competition like we're seeing at the XL Center this week comes injury. So who responds then to the gymnasts when they have sprains and pains, or potentially, hopefully, but potentially even worse? Dr. Christopher Lena, Doctor of Sports Medicine from Hartford Hospital, is joining me now in studio. Good morning to you, and thanks for coming in.
Good morning. Thanks for having us.
You're one of a team, actually, that is going to be responding. Are you literally on the mat then at the XL Center?
Yes. There's always going to be orthopedic surgeons on the mat, as well as physical therapists and athletic trainers will always be there throughout
Everyone
the entire
with their
event.
own specialty.
Yes.
So, you know, obviously this is a high-level form of competition here. Athletes have been training. They're used to kind of beating up their bodies. What injuries could they sustain that sort of above and beyond what they're already dealing with? Gymnastics
is a very rigorous sport, and they sustain a lot of injuries and a lot of axial loading injuries to the body, to the lower body, but also to the upper body that you're not used to having. So they can sustain many injuries to the shoulder, including tears of the tendons and stabilizing structures around the shoulder, dislocations of the elbow, or sprains to the wrist. In the lower extremities, you get injuries to the knee and ankle, including sprains and strains as well. With the heavy loading and ballistic maneuvers that they do, you sometimes can get stress fractures in the lower extremity or upper extremity. And what we really worry about is we worry about them getting injuries to the neck, concussions, and also low back injuries. Because these kids are doing a lot of acrobatic maneuvers with their low back, and they're very flexible. That increased flexibility can actually lead to them getting some more instability and problems with their low back.
Well, and they're such hardcore athletes. They've been training for a long time. They're used to working through pain. Does it happen sometimes that they have injuries and they're like, oh, no big deal, it's just it's an ache or pain? To the rest of us, we'd be completely out. But for them, I mean, do you have to work to try to identify, that's an injury that could have some serious implications if it's not treated?
That's actually the problem with this population, is that they don't want to be off the mat. They want to be on the mat. They want to be competing all the time so they get to the next competition, the next level. They don't want to be pulled from participation.
Right.
So they will downplay their injuries. So we have to actually watch and see when they're giving those signs that we know that they're injured, pull them aside and talk to them and make sure that they're okay to keep participating. Because when they're up on the high bar, you don't want them to be, you know, milking an injury or having an injury that they're not addressing appropriately.
Right. Yeah. I mean, for them, a sprain or even like a little fracture, I'm sure, is no big deal. It's like the show goes on. So your job is also trying to identify that. What about aspiring gymnasts? There's going to be a stadium full of them. For all those athletes there, what advice would you give for them in terms of taking care of their body? Because this is something the gymnasts, the athletes are always doing. This is their vessel. This is what they've got.
I think a couple things are important in terms of your gymnastic career. I think getting a good coach is very important, because they have to guide you through so that you're safe in your progression through the different levels of the participation.
And not push you when they shouldn't.
Correct, because you don't want to be pushed above it, because that's when you're going to get injured. You want to maintain your fitness level, so that means at the beginning of the season being in top physical condition. If you're not, you have to work up to that top physical condition. So during the off season, they have to keep an aerobic strength and flexibility training at all times. You want to stretch before exercise. All of us say we do it, but we really don't do it that often.
Yeah, that's true.
And you really want to do that, because a cold muscle is one that is prone to injury.
Right.
You actually want to stretch after exercise as well. That will decrease the muscle soreness that you get and give you long, flexible muscles to help participate.
And that goes for all of us. You're so right. The warm-up, cool-down, that's the first one to blow off, but it could be the most important in many situations.
Hydration is always very important, because any level of dehydration can lead to decreased athletic performance as well. So it's important to do that.
Great tips. Thank you so much. We'll see you on the mat. Dr. Lena.